CPAP therapy can be unbearable. We're Keros Biomedical and we aim to change this. Meet the Sleep Band, the world's first smart oral appliance for the treatment of obstructive sleep apnea and snoring. The Sleep Band operates by gently advancing your lower jaw forward during sleep. This clinically validated strategy has been shown to be highly effective. Created from a 3D dental scan, the Sleep Band fits your teeth and your mouth perfectly. It's comfortable and it's easy to use. And while the Sleep Band is a state-of-the-art electromechanical device which tracks all aspects of the patient's sleep, the Sleep Band itself couldn't be easier to use. Just plug the Sleep Band into its UV cleaner charger during the day, then use it at night. That's it. And while the patient sleeps, the Sleep Band tracks all aspects of the patient's sleep, and this data can be transferred in the morning by Bluetooth to a dedicated app on the patient's smartphone and even relayed by a single button press to their physician. The data can be used to both track and improve the therapy as delivered by the Sleep Band, and while the data is there, the Sleep Band makes no demands on the patient to use it. The Sleep Band can be used in a sophisticated manner or in a simple manner. It's the patient's choice. The Sleep Band is both flexible and powerful and contains features heretofore unheard of in any sleep apnea therapeutic device. For instance, the Sleep Band includes a low oxygen alarm based on an integrated pulse oximeter which takes oxygen readings off of the inside of the cheek. The alarm will sound, waking the patient should the patient's blood oxygenation level fall to dangerous levels, a common and serious issue for sleep apnea sufferers. But exactly why does the Sleep Band work? And why do we believe the Sleep Band represents the future of sleep apnea and snoring therapy? Let's take a closer look. Obstructive sleep apnea and snoring are breathing disorders which take place in the upper airway. They are somewhat similar, although they differ in their underlying severity. With normal breathing during sleep, absent sleep apnea and snoring symptoms, air flows into the mouth and nose, down the pharynx and into the lungs. The breathing is not obstructed by any significant narrowing of the airway, as the airway remains open, allowing for proper airflow. However, during snoring, there's a significant narrowing of the airway caused by an excessive relaxation of the muscles in the airway, causing the soft palate to vibrate with airflow. The vibration produces turbulent flow in the airway and the noise we associate with snoring. In obstructive sleep apnea, the problem is more pronounced. The tongue and soft palate relax even more than in snoring, and this produces a complete blockage of the airway. As the oxygen level in the lungs falls, the patient wakes and gasps for air to re-establish airflow before falling asleep again. This sequence repeats itself throughout the night. In CPAP therapy, elevated delivered pressure presses on the airway tissue and wedges the airway open. There's no debate about the effectiveness of CPAP therapy. It works, but unfortunately a large number of patients abandon the therapy due to comfort and aesthetic objections, amongst others. Oral appliances are another treatment option. They pull the lower jaw forward, opening the airway, and are also highly effective. However, as with CPAP devices, these devices suffer from basic comfort concerns, as only some oral appliances even fit the patient's teeth, and all current oral appliances wedge the patient's jaw forward before the patient is asleep, forcing them to fall asleep with their jaw uncomfortably extended, disrupting their sleep pattern. The Sleep Band is different. It's created from a 3D dental scan, so it fits the patient's mouth perfectly. In addition, the Sleep Band monitors sleep and slowly deploys the jaw forward during apnea and snoring events while the patient is asleep, which is not disruptive to the patient's sleep. When the patient awakes, the patient can easily realign their jaws by pulling their lower jaw back into alignment. The Sleep Band will then be reset and ready to be redeployed should the patient fall asleep again. And just how might the Sleep Band change your sleep life? Significant amounts of intellectual property have been submitted and are processing on all aspects of the sleep band, from hardware configurations to algorithms, including noise cancellation and AI-based snore recognition algorithms, to configuration and manufacturing methods. The intellectual property portfolio for the sleep band is broad and substantive. The sleep band is a Class II medical device and will require FDA 510(k) approval. Please see our supplemental materials for additional details. CPAP technology is problematic, and we have the solution. Won't you join us in making the sleep band the disruptive, groundbreaking technology which changes sleep apnea and snoring therapy forever? The Sleep Band by Keros Biomedical.